Hello guys, welcome to our channel This Surgery Times. Myself Dr. Aditya Prasad Padhi. Follow us in Instagram, Telegram, Facebook as well as in YouTube, and our podcasts are available in Spotify, Amazon Music, Apple Podcast as well as in Google Podcast. So use the audios and videos along with quizzes in our Telegram group. So today's our new topic is mnemonic on urolithiasis. So basically renal stones we will discuss along with few points of ureteric stone and along with mnemonic. You will must get a question from this. Like, comment and share with your friends and utilize the video. So our mnemonic is first mnemonic CBS Publication. Everybody aware of CBS Publication? And the authors are Henico and Foxamine. These two names you have to remember. CBS Publications author are Henico and Foxamine. So what does it indicates? Basically the stones and the shape of the crystals in microscope. So CBS, first follow the red, cystine, brucide, struvite, followed by Fox, calcium phosphate, calcium oxalate. Okay, so cystine stones are basically hexagonal. Now brucide stones are needle shaped. Struvite stones are coffin lid. Okay, now calcium phosphate stones are amorphous. Calcium oxalate dihydrate are envelope shaped. Okay, so we will see one by one. So this is the cystine stones, that is hexagonal. Next is brucide stones, those are needle shaped. Struvite stones, these are coffin lid. Okay, or rectangular, remember rectangular, this is rectangular. And along with that you remember calcium phosphate, this is amorphous in shape, and calcium phosphate apatite also amorphous in shape. Now calcium oxalate dihydrate are envelope shaped. Calcium oxalate dihydrate, otherwise tetrahedral. This is taken from Campbell. So all the options here I have mentioned so that you will not forget or make it wrong, because with mnemonic you should remember for long. During going to exam only see the mnemonic. Now our next is two other stone we will discuss. UAE is famous for diamond. All everybody aware of this. So uric acid is diamond or rhomboid shape. Okay, this is the microscopic view of the crystal, uric acid crystal. Next is calcium oxalate monohydrate is hourglass shaped. This is also from Campbell, recent editions, and the crystal will look like this, hourglass shape. Now two important points is radio opaque stone and radiolucent stone. So you can detect in X-ray radio opaque stones but not radiolucent stones. So what are the examples? So radio opaque are, always remember, calcium based mostly. So calcium oxalate monohydrate or dihydrate, and calcium phosphate, these are radio opaque stones. Whereas radiolucent stones are UD-max. Okay, uric acid, then drugs like indinavir. It is very rare condition. Others are 2,8-dihydroxyadenine, matrix, and xanthan stones. Now next is we will discuss few most common things in urolithiasis. Most common type of renal stone is oxalate stone. Many times came in NEET. And oxalate stones are most commonly associated with hematuria. Most common stone in infection is triple phosphate stone, otherwise called as Staghorn calculus. Most common bladder stone, this is a very confusing question, is secondary bladder stones. And most common primary bladder stones are calcium oxalate, whereas most common secondary bladder uric acid stones. So C followed by U for bladder stones. Now Mineral names and renal calculi. We will discuss few renal calculi along with their mineral names. Okay, mineral names I will mention here the formulas, but you should know the name, not necessarily the formulas. So we will discuss regarding struvite, brucite, whitlockite, widellite, and wewellite. Okay, so last two are oxalate stones. Okay, so let's see. Struvite stones are nothing but magnesium ammonium phosphate stones. Brucite stones are calcium phosphate dihydrate stones. Whitlockite are triple calcium phosphate stones. Now widellite and wewellite, you see double D are there. So calcium oxalate dihydrate, di, because double D, dihydrate. Okay, widellite. Wewellite composed of calcium oxalate monohydrate. Okay, now next is we will discuss from practical point of view few points. Basically lower pole stones. Okay. So let's start. First is less than 1 centimeter stone. Favorable anatomy. Hounsfield unit less than 900 and skin to stone distance less than 10 centimeter. So you will prefer ESWL, extracorporeal shockwave lithotripsy, because favorable anatomy I will discuss what is that. Because of favorable anatomy, the stone will break and come down to the ureter, and through the bladder it will come out. And also the stone is soft. That's why Hounsfield unit is less than 900. And also the skin to stone distance is less than 10 centimeter. These are the favorable conditions where you can try for ESWL. Now coming to the less than 1 centimeter, same size stone but unfavorable anatomy with Hounsfield unit more than 1000, skin to stone distance more than 10. Means suppose this is the abdomen, okay, this is the kidney, here the stone is, so skin to stone distance, if it is more than 10, means obese patient, it is not favorable for ESWL. Okay, so unfavorable anatomy are acute infundibulo pelvic angle of less than 70 degree, and second is long infundibular length. Okay, long infundibular length of more than 3 centimeter. Third point is narrow infundibular width. Okay, width of less than 5 mm. Okay, so these are the unfavorable anatomy. If any patient you are seeing this in the 3D construction or in the CT, you can come to know all the 3 points: unfavorable anatomy, and if the stone is hard more than 1000 HU and stone to skin distance more than 10, then you should opt for RIRS, retrograde intrarenal surgery, because here this is the kidney, ureter, this is the bladder, urethra. So retrograde means from the urethra you are going towards the kidney and breaking the stone, taking out. So this is the retrograde intrarenal surgery. Okay, and here the flexible scopes are used. Next is our 1 to 2 centimeter stone. So you can opt for PCNL as well as RIRS in those cases, but the patient, especially anticoagulants or blood thinners like ecosprin, clopidogrel, then you can opt for RIRS, because in PCNL there is high chances of bleeding is there. Now next is 2 centimeter stone or more than 2 also, you can opt for PCNL, either mini or standard, but you can go for PCNL. Okay, and this is also from Campbell, from if the stone is proximal ureter or distal ureter. So renal we have discussed. Now bladder. So if proximal stone, if distal stone, what to do? So proximal ureteric stone more than 1 centimeter, less than 1 centimeter. So if more than 1 centimeter, then you can go for URS, okay, antegrade or retrograde. You can opt for also ESWL, and if it is less than 1 centimeter, then SWL or URS. Similarly, in the distal also. But ideally, you remember distal ureteric stone with patient have mild symptoms without any deranged in RFT, no creatinine increased, okay, and there is no edema of the ureteric mucosa, then you can try for MET, medical expulsion therapy. I will tell. Now these are the questions, okay, you can answer yourself. Most common bladder stones: magnesium ammonium phosphate stones, otherwise called as struvite stones. Brucite stone crystals are needle shaped. So this is a newly framed question, just I have put in order to better understand you. So 55-year male with pain abdomen intermittently since around 1 year. NCCT KOV 0.9 centimeter, right lower renal pole calculus, and HU is 750, very soft. And these are the things given of a favorable anatomy, as we have discussed. Then you can go for ESWL. Okay. Now medical expulsion therapy indications are well-informed patient, tolerable symptoms, and without UTI, and small ureteric stone of less than 10 millimeter, and basically mid to lower ureteric stone you can try for better outcome. And contraindication of MET you will never try in those cases like solitary functioning kidney, means one kidney, okay, other is non-functioning or already operated. In case of urinary tract infection, intractable pain, and impaired renal function test, in those cases medical expulsion therapy is contraindicated. So medical expulsion therapy, basically you should know antispasmodic, okay, second is alpha blocker, third is diuretics. Okay, so antispasmodic because of pain and spasm will decrease, and alpha blocker basically given in order to relaxation of smooth muscle. Okay, some books also given CCBs, calcium channel blockers also you can use for smooth muscle relaxation like nifedipine. Okay, and also some books has given if there is presence of inflammation with edema, then steroids can be given, but ideally only these three things you should know. And diuretics because it will help in pushing up the stones while coming in the ureter. Okay, so this is the advantage of medical expulsion therapy. So we have discussed regarding the urolithiasis. Go through the video repeatedly, remember the mnemonic, and you must get questions from this. And like, comment, and share with your friends, and stay tuned for our next video. Till then, thank you.